shuffling the people on the panel to welcome in seamlessly Andreas, Cleve and Juliet Bauer. So thank you very much, both of you, for joining us. Hopefully you got an opportunity to see a little bit of that panel session. And we're going to continue now with a bit more of a focus on the technology and health tech industry side of our response to COVID. So to start us off, Andreas, let's go to you first. Tell us about your experience at CORTI and particularly around the use of data. We've just heard that there's going to be a lot more data, particularly if we're all doing daily diagnostics tests. So how do we want to use that data, and how's your experience to date been?
Well, I represent a company working out of Scandinavia. We're 60 people, and the majority are from Europe. And we're building AI technology, so artificial intelligence, that helps increase the quality of diagnostics and triaging. So our goal is making sure that every patient has access to expertise. That's the end goal. And to do that, we need data, of course. So we have traveled the world to find the best healthcare organizations who have, prior to COVID, of course, great troves of healthcare data available, so we can start building testable, trialable machine learning models that actually can prove to have a value for patients in the end. And I think this is a major value for Europe, having a quite good, if we look across the union healthcare sector, that has accumulated quite a lot of data. And this is definitely an area where if we find a meaningful and ethical way of working together, both as private and public companies, we can span a whole industry of interesting offerings around the possibilities of using big data and small data and machine learning and other technologies to help patients get more service every day.
Excellent, thank you. And as we look at sort of what that data means, it's about health and well-being, not just being able to treat sickness. And I think that's going to be quite a big shift in people's understanding and engagement with their own health data. As part of that difference of engagement, I want to bring in Juliet Bauer, who's Managing Director of LIVI UK, to really understand the shift in delivery, and particularly to online phone and video consultations for things that otherwise historically people would have had to be in person to receive. So what's been your experience in the last 6 months as LIVI, and really what is your challenge for the next 6 to 12 months going forward in embedding and scaling what you've already seen through COVID?
Yeah, hi, Maddy. So as you said, UK Managing Director of Europe's largest digital healthcare company, and like Rachel, also used to work in the NHS. So here at LIVI, we partner with healthcare systems to help patients see a doctor or medical professional anywhere, anytime, at the touch of a button. And I think it's obviously been a really exciting kind of present for us, and we also see a really exciting future. I think we hope that healthcare is going to be reimagined, and that's going to be reimagined around a promise to the patients of better access to care. We hope that patients will be more proactively cared for, as Minister Hancock talked about. We hope that clinicians will have more time and information to care, and we strongly believe technology will and is already enabling that. And we overall hope that the system is a much smarter and self-improving ecosystem based on much richer and real-time data. So if all those things come together, then we have, a pretty promising future ahead of us, I think. I think at LIVI, we've grown significantly, as you'd expect, over the past months. We're now in 30 countries. We're helping 10 times the patients we were last year in the UK. And we've moved beyond primary care to urgent care, working a lot in mental health, launched new services. And what we're trying to do is do that for everyone. So core to kind of our vision is that we are absolutely helping everyone, whatever age they are, whatever income bracket they're in, to access care. I think there's some big challenges ahead. I'm sure we'll talk about some of those in the panel. To ensure that access comes hand in glove with efficiency and cost savings, of course. And also, of course, what model do you employ? And we've seen a lot of different models on the commissioning side emerge over different countries within Europe. So some of these big questions we're absolutely looking at now and trying to help the different systems as well. Think about what could be and how do you seamlessly access the benefits of scaled digital healthcare that some nations have been better able to do during the pandemic potentially than others.
Thank you. And I think let's focus in on that. The panel was around health and social care. Social care being personal care delivered, whether that's help with getting out of bed, dressing, eating, washing, for example. I realise that term means different things in different countries. How are we thinking around, and this is to all the panel, if whoever wants to come in first, is this going to help us break down those barriers? We've heard from Juliet, potentially between primary care and acute care, or acute or mental health. But how are we thinking more holistically about the individual and the experience for the individual as they experience care and support with their well-being? Is this an opportunity now with, coming out of the first wave of COVID to really reset some of our thinking on that? And how is the health tech industry going to play a role in it? Who also? Rachel, you're nodding.
So I agree with a lot of what Juliet said. I think we've got to start to use tech better to triage and create kind of more efficient processes. And whilst we've seen a huge adoption of remote consultations over the last 9 months and virtual consultations, I think there's a real need to have the data to support that changing model and the traditional way of actually delivering that care. And that's, we've had to adopt it because of the circumstances we're in. And whilst there was resistance to some of that previously, we've seen, huge successes. But I think that there's probably a need to understand better which services need delivering digitally and which ones still need to remain in person.
Frédéric, to bring you in on that, what is your perspective from either a French perspective or particularly from a Docaposte and being able to connect the dots perhaps at a larger scale that you're able to do?
As the ministers said in the previous panel, I think that what we have learned from this crisis, and we are still learning at the moment, is that three points: interoperability, because if we want to make the life of the patient, of the people easier, we have to help them to communicate in a complex environment. Like healthcare, between the patient itself, the doctors, the people working in the healthcare area itself, and all the paramedics around that, because this crisis has demonstrated that we need to interconnect those three spheres of the ecosystem. So interoperability is first. Speed. We have seen during this crisis that the capabilities to deliver solution off the shelf with a high level of trust from the patient is key. So, we have to have everything ready to be able to interoperate these systems between together. And third is security, of course. All this data dealing with personal data, which are, the people life itself, is very important. It needs to be secured. I think that the government initiatives like Gaia-X between Germany and France, trying to build a sovereign infrastructure shared around Europe, is one of the examples of the good initiatives that government can take, where private companies like us, like Docaposte, like LIVI, can put the application on it and interpret it with the right level of security, with no breach on personal data.
Thank you. And let's bring in Andreas on that point around the sort of data that we are collecting. It's very, very personal. It's intrinsically personal. You can't get more personal in some ways. So how do you see that sort of view about consumer trust around both the sort of actual security of the data and not having data breaches, but also the consent and the trust from consumers to use data ethically and for their benefit, as well as when it's their direct benefit for their own direct care, and also a wider community benefit, for example, from understanding their potential exposure to COVID. What's your experience of that consent model and how is that evolving?
Very interesting question, I think. And I think we're in murky waters, right? Because I, as a patient, can use private operators to handle my data. I can even create new data points when they screen me or dispatch me or triage me on video platforms or whatever. And that data, of course, is, if you read the terms, usually not owned by you as a patient. But we're in this paradigm where, especially how we want to legislate it from a European perspective, is that the data we give to the healthcare sector is something that we lend. It's like a lot of the other things that we have the public sector operate. It's something where we expect a certain level of security, transparency, and liability if people leak or misuse our data. But we're in this gray space where we end up using more and more private operators to help us out when we need it, and we're not sure as patients where our data ends up, right? Because ultimately, we as all of us patients, at least me, I would love to provide parts of my data to help whoever I can help. In the end, that will actually give a benefit to another patient. But I don't know what kind of agreement I'm actually making, because I don't know in the end who ends up operating my data. And that is where we have, right? Because we can tend to lend more and more on private operators. They create new data points, and we are not in any way in a paradigm yet where there's transparency on what that ends up meaning for me as a patient.
Rachel, I think on your understanding of that sort of bringing together large data sets, something that is aligned to the interoperability agenda, in that we should be, as the ministers mentioned earlier, trying to require, for example, as they do in Germany, that all publicly funded data solutions have interoperability standards that they must implement? Or is there anything else that we should be doing in terms of not creating those islands of different pools of data, as Andreas is urging to, that we've got at the moment? I'm not sure, Rachel, if we can hear you at the moment. So perhaps if we come back to, I target that at, are you back?
I'm back. I'm just saving Juliet from that question. I'm back. So in way of the UK, we do have interoperability standards. So we have the FHIR standards. And I think we've taken a different approach to Germany. So I don't think we've mandated in quite the same way. And I expect that probably explains why we're not quite as far ahead in that way. So I think that there is a real need to drive that agenda. I think that this was a huge problem before COVID. And I think it's something that we almost need to take a step back from and kind of create some situational awareness around the environment, and then get a plan. And it's not the sexy stuff, and that's a difficulty. It's the real kind of grind that we will have to do to fully understand where our data is and get a robust plan around data sharing for the future.
I think key, Maddy, is of course patient consent and patient control, and I think as long as you hold those values core to what you do, then you're going to be able to do good stuff. I think, though, you also have to focus on what the data can enable you to do. And of course, if you have kind of scaled access, scaled care, and scaled access to the insights that can give you, you're able to respond very quickly. And one thing we've seen is, very recently, of course, a huge surge in demand for mental health services. And we're able to respond very quickly with self-tools to understand, do you need care? And with a range of actual tools to help people to get better and to manage through what is obviously, a very, very difficult time for people. And I think, some of that is not possible without access to this kind of data. So it's worth remembering the value that it brings.
And connecting those together on behalf of the patient, and really remembering everything, I think is one of those key foundations, I suppose, that healthcare professionals may have been taught originally, or maybe they would when they were obviously continuing professional development. I just wanted to reflect on the tools we're giving, or we will need to give to our healthcare and care professionals to be able to both understand the data, understand the what it is telling them, the relative risk, or is that something that we are doing enough of in terms of helping our current generation and maybe the next generation of health and care professionals to be equipped with the tools to use the data that we are collecting? Frédéric, do you have a view on how we're using that data and whether we've got the skills to do it yet?
Yeah, I think that, again, it's through the usage and the way the people are working with this data that we will build this environment. I mean, for example, if I tell an example of what we have done with Maddy coronavirus application, I mean, we have collected the data based on scientific analysis with the professor Fabrice Denis, for example, and people who are specialized in data analysis in a safe and secured environment. And it is once we have collected the data that we have learned how to use it and build the model used and to develop the usage of this data. I mean, at the beginning of the site, we were not thinking about showing maps with different colors and so on. And the usage and through the analysis of the people working with this data, we have built this environment who is today operational and gives satisfaction to the user. So I don't think that there is the right model before. I mean, it's by collecting the data in a secured way and developing the usage of the people that we will build the right application and the right usage and the right tools to develop healthcare environment.
Andreas, what was your perspective? Because you obviously trying to find people with data scientists and people who can interpret the data, but using that in a day-to-day environment to help with diagnosis and treatment of patients. How have you seen that data literacy within the medical or the clinical profession?
I think this is something we've both been astounded much a willingness and ingenuity that is happening already in healthcare organizations, qualify and upskill staff members and staff members who seek out knowledge, which is amazing. What I will say is, of course, that we as technology providers, we enter a space that is built on very different. In the health technology today, I subscribe to very different values than the healthcare sector, and I think that's for a very good reason, right? We don't need to take the same kind of risk on us when we operate normal technology, which we do here in healthcare. So qualifying is just such a thing, and co-owning that experience of figuring out when we as technology providers, are we just the provider there to support, and how can we help providers or professionals actually analyze and take action on top of the data that or the models or the innovations they're getting, which is increasingly hard, right? Because even within the technology space, technologists are having a hard time coming up with all the different outcomes, which we've seen in so many other spaces where we thought it wouldn't be that bad that Facebook aggregated that many data points for commercials, but now all of a sudden we're discussing what that meant for legislation or political elections, right? And that is just where we, at least as healthcare professionals, as technology providers, need to help healthcare professionals be the decision makers on top of our platforms. Mm-hmm. That's something where we still have a lot to learn, and humility.
Thank you. I'm not sure if everyone can still see and hear me because it's a bit in and out on the video. But my next question was around the role that Europe has in the future of health tech. So we've talked a little bit in this panel and in previous panels about the data that the US companies, Facebook, etc., have on us. Is this a moment for European health tech to really accelerate and springboard out of COVID and to become a really global leader in developing the sort of technologies of the future in the healthcare space? I'm going to ask Juliet that question first. As an existing international player with extreme growth in the last 6 months to 30 countries, do you see that as just the starting point of sort of European companies leading the way in tech?
Absolutely, and I would say, we're already leading the way in many spaces, absolutely, and we also can learn a huge amount. We're working across multiple European markets, And what we can learn from France and Germany and Sweden and Norway and everything that's happened in those countries can make a huge difference, absolutely, in the UK. I think it is worth reminding ourselves, Maddy, that this is a global opportunity, of course, and that the problems are not solved in any country. So I don't think what's has solved every problem. For patients, many patients in every country still say they find it difficult to access care. A recent survey in the UK said kind of 40% of people were delaying accessing primary care. That's not a situation we want to be in right now. And you see some similar stats across different countries as well. For clinicians, a recent survey said that 50% of clinician time can be freed up by automation by 2030. And that's true in every country. And all clinicians want that so that they can spend more time caring for their patients. And for the system, no system has access right now to perfect data in real time. So I think if we can work together, absolutely across Europe, but also beyond that, to solve some of those challenges, then I think we've got an amazing opportunity to make the whole thing better.
And Andreas, from your perspective, the barriers to international development, I suppose, of the technology solutions are sort of coming down. But are we putting up any regulatory barriers in its place? Or are you actually thinking this is an opportunity for a new wave of European health tech?
So I agree on a lot of the stuff Juliet just said, really, really good points. And I think that the cooperation part that we actually are able to, both across borders and internally in each nation state, are able to create operations that actually lead to opportunities, right? Specifically, the world I'm from, which is artificial intelligence, is of course a very data-intense avenue, and it's very research-driven, right? And luckily, historically, Europe has been a hotbed for mathematicians and machine learning scientists. And to be able to build on that, we need to create access to more interesting data, because a lot of the mathematics makes out long access, but
okay, so my final question, thank you very much, Andreas, for that. My final question in the last 5 minutes we have together is, from your perspective, what do you think are the positive legacies that we should be taking forward from what has been a horrendous 6 months for most people around the world? But what are those things that you would like us to either start doing now or not stop doing? And I'm going to come to Frédéric first. What would be your wish, I suppose, for a positive legacy from the last 6 months?
I think that the positive points of this crisis is that we have demonstrated, at least in Europe, that the government and the private sector, when they decide to tackle the difficult issue, despite that we are dealing with healthcare issue with a very strong regulation, very strong security constraints, and so on, we have been able in less than a few months to answer the difficulty, to bring a solution to the market and develop usage with the people, as Juliet or Rachel explained, in UK or in Sweden. So I think that these capabilities to operate in a regulated environment, but with an improved speed of reaction, is one of the positive impact of this crisis. And I hope that the government will keep the pace and still develop this kind of private government initiative for the benefit of the people.
Thank you. Juliet, what would be your positive legacy hope for the future?
I think the huge positives, as just said, work together. We've solved a lot of problems for sure, and we've built a lot of trust from the public in how tech can really help keep people safe, of course, and deliver great healthcare. I think, what we now have to do is listen to the public. How do they want healthcare reimagined? How do they want it to be in times when we have coronavirus, in times when we don't want it? And I think, in most countries, we can be better at putting the patient at the centre of designing that.
Fantastic. Thank you. Rachel, let's come to you next.
So I think probably two things really, Maddy. I think there's been a lot of goodwill, and of course that doesn't continue on endlessly, but I think that has played quite a strong part in the response, certainly from a UK perspective. I think my hope is that we have gone forward. We've gone forward a lot in lots of different areas over the last 9 months, and it would be a real shame to see some of the nervousness around business change reappear. And so that momentum needs to continue at a more manageable pace. But I would also echo Juliet's point, building services from a user-centered design perspective is absolutely key. And we should always be building services with that in mind.
Thank you. And we'll come finally to Andreas, if you're still on the line with us. What's your hope for a positive legacy from this last 6 months? I think we might have lost Andreas, which is a shame. And I think, from my perspective, I'd just like to say thank you very much to the whole panel coming together. This is a huge...
I think a lot of good is said, and I hope we'll...
Oh, Andreas, are you back? Okay, we're going to wrap up now. But thank you. I just wanted to thank every one of our panel, to Minister Spahn and Minister Hancock, who joined us for the first part. Rachel and Frédéric, who joined us throughout, and to Andreas and Juliet for the second half as well. Obviously, this is a crucial time for everyone in the health tech community, and that working together across government sector and public sector, private sector within the health tech space. We've got so much more that is possible, so many opportunities to follow through on, and I hope that this is the start and the catalyst for further change, which we'll look forward to seeing. So thank you very much, everyone, and we'll pass back to Ruby and Mark. Thank you.